Afternoon, everyone. I'm really happy for everybody who's joined us today. My name is Jeremy Reuling. I am the Senior Director of Special Projects at Hands Across Long Island, which is a peer-run organization on Surprise, Long Island. And we provide a number of different kinds of support services, including both direct services as well as working with other organizations to help them to better work with their own peer workforces to hopefully implement the peer role as well as possible. Additionally, I'm on the board of directors for the Alliance for Rights and Recovery, and also do some work with Peer Tech, which Rita will tell you about, and a few other things here and there. And I've been working in peer services for close to 15 years now.
All right, well, I've got you beat. I've been working in peer services for about 20 years, 1999. That's when I got started. So I'm Rita Cronise, and I am with Rutgers University. We do in New York State the training for peer specialist certification. It's called the Academy of Peer Services, and all of it is online. And once people complete their online courses, they go to a certification board to apply for certification. I recently was invited to become a director, a co-director for what's called the Peer Support Services Technical Assistance Center, or Peer Tech, and you'll see my little logo here. And we are mostly, our mission is really to help organizations to make a smooth transition to offering peer support services, particularly the more clinical services that sometimes have a little bit of challenge in understanding what the role of peers is and how peers can best be used within their organization. So that's what our Technical Assistance Center is about. And with that, I'll pass it on to Jessica.
Thank you, Rita. Well, I've been involved for many, many years in advocacy, program development, implementation, all you name it, lots of different things, both within the state of Connecticut and across the country. I've been principal of Decision Solutions Consulting since 1997, and my real focus has been peer workforce development in a lot of different assignments to promote the strength and efficacy of the peer support workforce. So this is very dear to my heart. And I'm very delighted to be working together with Rita and Jeremy, and also to be with you all today. And I guess we can go on to the...
Yes. Sorry, I was trying to advance the slide and it got stuck for a second. So today's agenda, so we're already done with the introduction, so I think we're good there. We're going to discuss with you the top 10 priorities action agenda. We're going to talk about what that is, where the 10 priorities came from, and let you know sort of what you can do with this document that we've spent some time developing. We'll talk about the timeline for how it got developed. We're going to talk about some of the literature that backs it up. We're going to talk about who are the different stakeholders who this document is meant for, and how we were able to come up with recommendations specifically tailored to the different stakeholders. We'll talk about the way to prioritize and identify what advocacy strategies might be helpful. And we're going to have a little bit of a chat exercise to help people think through some of that. And we will hopefully have some opportunities for everybody to share some of the ideas they came up with, again, using the chat. And then, assuming we have some time, we'll do some Q&A and some basic wrap up.
Thanks, Jeremy. It's supposed to go. Hello. There we go. So now we'd like to give all of you a chance to introduce yourselves. Just in the chat, go ahead and put your name, where you're located, what your role is within, especially in proximity to working with peer specialists. And then maybe just a quick, 1 or 2 word challenge, one challenge that's related to the peer support workforce. So let's take about 3 minutes to go ahead and add that to the chat. And we'll start humming to ourselves in the meantime. So again, your name, where you're located, your role, and just one challenge that you have in working with the peer support workforce, either working with or within. And as you're putting that into the chat, I'm going to go ahead and move forward. And ask Jessica to start just talking about what is this action agenda, and we'll come back to some of your chat answers in a moment.
Okay, sure. As we're describing it, it's an organized list of challenges that we've heard from the peer support workforce during the several years that we've been involved in this project. And we've listed them as priorities that need to be addressed to improve conditions for the peer workforce. Those priorities are not in priority order. We never wanted to do that, but I want to make that clear. And also to say that, as I think both Rita and Jeremy have said, we're really looking to make this be an experience that people can use in their existing workplaces and in their advocacy efforts. So this is not a, document that is going to be exactly the way it is. It doesn't matter. What really matters is how you can use it to make a difference in your work situations. Okay, we can go on to the next. Or you want to wait for people to?
Yeah, I'm scanning through some of the opportunities. So let's take just a moment to pause and look at some of the challenges that are coming up.
Yes.
And
Yeah.
I'm seeing things like having professional development opportunities, and that's certainly one that we had identified, that has been identified within our top 10 list. Finding peers, recruiting and finding peers, finding more peers. Yep. And low pay.
Yep.
Yeah, that one's one we got. Community inclusion, that's an interesting one. And we touch on it, but maybe not as directly as saying that specifically. Just learning near the Texas-Mexico border and finding and retaining peers. Yep. Challenges being part of an integrated healthcare team, certainly. The challenge is being part of an integrated healthcare team. I think I've got a double there. One challenge is building resilience and tolerance for discomfort and frustrations. Wow, that's a great one. That's a great one. Only listing one challenge is hard. That's really good. One challenge is working within the peer workforce is helping them find roles once they become a peer. Now that's an interesting one. We might want to touch back on that in a little bit when we get to our activity. Here to listen and learn, good. The work schedule, okay. Challenge is finding staff. So that's popping up a lot is actually being able to recruit or find staff. Sustainability is a really important one too. Good. Community inclusion, low staffing, lack of funding. Boy, I was thinking I was going to run to the end here. Also being able to help folks who have private insurance. So one challenge would be educating more treatment centers on the importance of peer support and what it means. That's great. Training, certification. Oh, cool. Looking to build the peer support workforce. That's great. Hey, Kim. So challenge is supporting peers to be integrated into behavioral health systems. Terrific. Inconsistent scope of work, billing inconsistencies, lack of accountability and oversight. Those are all great ones. Lack of adequate housing, collaborating with providers as a peer-run organization. That's one that we should really talk about if we have a chance. Long travel. Now, I'm wondering if I'm starting to run out of time here. I'm thinking we've got a lot of really good challenges here, and we're going to save this chat and come back to it. But I think what you've identified in the chat is really important, and a lot of these things are things that we've heard over and over and over again, which is what this is largely about. I'll pass it back to you, Jessica.
Yeah, before we
Okay.
advance, also, I had meant to do this on the title slide, but I would like to do it with this slide. Is just, you'll notice there is a QR code on the page. And if you would like to scan that, that will actually take you to the document itself. So you would be able to read it, you would be able to see all of the priorities, you would be able to see all of the tables with the recommendations to try to address them. Or if a QR code doesn't work for you, that little link next to it also would take you there.
And then you can download it and save the document.
Yeah,
because
print
it's-
it,
Yeah.
frame it.
Well, it's 46 pages or so, so, you know, it's good to
Well,
have it though, because you can look at different parts of it.
right.
Shall we go on?
Mhm.
Okay, so this is a short version of the top 10 priorities, and I will read them briefly. Again, not in priority order. 1, value the role of peer specialists as disruptive innovators. 2, raise wages equivalent to other support and service roles. 3, increase number of peer specialist jobs. It means working in a variety of different kinds of settings too. 4, create career opportunities for members of marginalized communities. Or another term for that is underserved, without making judgments about the nature of those communities. 5, fund leadership roles that do not require advanced degrees. 6, expand opportunities to build skill in supervision and management. This is a big one. 7, assure supervisors identify as peer specialists or have training in peer practices. 8, provide trauma-informed workplaces and services. 9, elevate wellness and grant time and resources to support wellness needs. 10, provide resources to increase technical skills for telehealth peer support. And now we'll sort of give you a very brief rundown on how we got here. This is a fun little chart, but I'm not going to go over every single part of it. What we'd like you to see is that starting in 2018 until now, there have been many different occasions in which we have interacted at workshops, conferences, and related events with members of the peer support workforce in order to find out what they think and feel are the key priorities, and then to test them with them. So the sort of first part of the process was asking people, what do you think? You know, sort of generating. And the second part of the process of the more recent years, post-pandemic, let's say, has been, okay, does this make sense? Does this resonate for you? And what would you do about it? And you'll see when we get to the action recommendations, that at the NAPS, National Association of Peer Supporters Conference, in 2023, there were a large group of people that Rita facilitated discussions with about action recommendations. So we were able to enrich the document very much with really specific things that people say that they can do. The challenge for any group of us like those involved today is, okay, fine. Is that a challenge for you? And how would you address it in your work setting? So this is not a blueprint. This is more like a stimulus to apply to individuals' work settings. Okay, that's enough for that one. I got
Could
the
I
next.
just add really quick?
Yes,
Because
please do.
the thing that I always like to tell people about the timeline is that in 2018, it's not like we knew that we were going to create this whole thing. It was just conversations. We were doing workshops about workforce issues because we knew that that was something that people had a lot of concerns about. But we didn't realize it was going to kind of grow into what it became. And it really wasn't until around sometime probably in 2022 that we realized we had all of this data and that we, without knowing it, had been doing this participatory action research. And so at that point, we said, let's actually get this into a more organized format so that it's not just lost information.
And then we struggled to think about what kind of format. And we started out thinking, as you see, 2022, 23, development of an article for publication. Well, in the action agenda, there are, for each priority, there's documentation, which is part of the next slide. Is there any evidence and what is it? We then decided that we didn't want to do an academic article. Thank you. We did want to address, is there any evidence for these priorities? And so each of us, we wrote up the evidence for each one of the priorities. But that was like, then we were sort of like, well, then we really started to think about what is our goal? What do we want to do with this stuff? And it had to do with an action agenda. I mean, that's kind of where we eventually got to, that we wanted something that we could disseminate to people so they could use it. And we wanted to include the evidence, which you will see, it's all there. We've got references and descriptions and so forth, but we didn't really want to stop there. So I think we can now go on to the next one. How can these priorities help the workforce? That's Jeremy.
So this is the question, right? So we came up with priorities, and I think a really key moment in the evolution of this project was when Rita actually had sort of the foresight to take this group of people at NAPS last year. It happened to be a pretty good sized group. I think it was 70 plus people. And instead of just saying, these are the problems, start asking the question about what are the solutions, right? And that really makes it so that we have a document that's not just about these are the concerns and, now what, but it's actually something where there's some ideas about trying to push forward with them embedded in there. And so there's a few different ways. And by the way, if anyone hears my dogs howling downstairs, hopefully you don't, but they're very loud. So there's a few different things people can do. One great thing we heard was from a group in California that told us how they had downloaded the document and actually brought it to sort of a leadership meeting and sat down with it and talked through some of the issues they were seeing and used some of the strategies and kind of had a strategy session using it as a tool, right? It's something that people could share with other people to help them think about strategies that might work in their own communities. I'll talk about the stakeholders in a minute because the stakeholder division is kind of one of the key ways that we try to make it really actionable so that no matter what your role is, whether you are a peer specialist who's providing direct services or you're somebody who's doing policy and advocacy work, there's kind of a lane in the document for you to help come up with ways to push forward with these concerns and priorities. So other things people might be able to do is to have meetings with perhaps local officials to see if they have things they can do. We can show people that these are widespread concerns, and so there's a lot of ways to use it. I think I'd be very interested to know how people might get creative with that. And so stakeholder groups, these are sort of the 4 groups that we identified. We actually, I think, identified that there is a 5th, which is allies of these groups. But basically, these are sort of the main levels that we decided to divide our action recommendations up into. So peer specialists, right? Those are any of you who are actually working as peers, providing direct services, supporting others in that day in, day out role. Supervisors, so whether it's a supervisor who identifies as a peer or who does not identify as a peer, but is interested in helping peer specialists to advance in their careers or to have better working conditions, there's things they can do at their level. Employers, or that's like agency level, right? So if you work for an organization, your organization might be able to do things to help better support its own peer workforce, whether that's through its own agency policies or whether that's through networking with other similar like-minded organizations that might also employ peers, trading ideas, things like that. And then policymakers, right? A lot of times the big changes are needed at that government level. So one of the very popular priorities that whenever we ask people which priority matters to you, a lot of times we get feedback that people are really interested in number 2, which is about wages. So that's an easy thing to say, right? But the thing is, most peer specialists are paid in programs that are receiving government money. And that government money is kind of limited. And sometimes the grant itself has certain restrictions in terms of like what salaries look like in the program that they're funding. And so it's really important that at that government level that we are pushing for peer specialists to actually be getting higher wages built into these contracts coming from the government in the first place. So there's a lot of different things that can be done at the policy level. I think, Rita, you're next.
Yep. Yeah. Thank you for sending that along or moving it forward. I was just looking at Betsy saying accomplices, not allies. I love that. That's so cool. So, and I was just thinking as you were talking, Jeremy, I have not had this thought before. So you guys are hearing this live for the first time, but allies or accomplices, whichever way we want to talk about it, that may be our next project, taking this to the allies or the accomplices and saying, we've got things for these stakeholders, but what are we missing that you guys can do? I think that might be a really cool project going forward. I'm kind of dodging the bullets from Jeremy and Jessica, suggesting more, but I just love that. So what can stakeholders do? Jeremy mentioned that we went to a conference last year, and the thought came as we were preparing for the workshop. What can I do as a peer specialist? There's not a lot that I can necessarily do about some of these different priorities that we've identified, but I may be able to advocate with some of the other stakeholders. So that may be the role that I take on. So it was really looking at identifying what actions as a peer specialist, or if I'm a supervisor, what can I do as a supervisor that maybe I never thought about before? And we went through all the 4 stakeholder groups and really looked at what we could do to identify those top 10 priorities. And I want to just sort of hone in on, this is the top 10 priorities. I'm going to go a little bit further and again, refresh what the top 10 priorities are. We don't have time to do all 10, and it might be interesting to do some workshops on each one at a time. For today, we're going to focus really on number 1, which is to value the role of peer specialists as disruptive innovators. And that's a term that we've heard through Pat Deegan. I'm not completely sure where she got the term from, but it really does apply to the role of a peer specialist going into an organization as a change agent, as a potential change agent, and could really make some significant transformative change if allowed to have that role. So we're going to talk about priority number 1, value the peer specialist, disruptive innovators as disruptive innovators who are empowered as essential drivers of systemic change. So this is the longer definition. So empowered as essential drivers of systemic change. So what would that look like, and how could that be brought about? So this is what one priority looks like and the action recommendations for the 4 stakeholder groups. We're not going to go into all 4, but I did want to give you just a treetop level of what some of the recommendations were for each one of them. So priority 1, value the role of peer specialists as disruptive innovators the action recommendation. So peer specialists, what they were saying in this workshop, and this was really all based on one workshop where the peer specialist said, here's something I can do. I can believe in the value of my lived experience and my ability to advocate for change. I can ask open-ended questions, listen carefully, and practice cultural humility. I can reframe stigmatizing language and educate as well as advocate. Now, you saw there was a much longer list in the actual action recommendation document, but we just really want to pull a few of the examples out of each one of the stakeholder groups. For supervisors, what can supervisors do? Well, create job descriptions based on competencies of peer support work, rather than duplicating the work of case managers, counselors, or care coordinators. To encourage peer specialists to embrace their ability to change the organization from within as disruptive innovators, or to train non-peer staff about the advocacy and system change role of the peer specialist on a multidisciplinary team. Going forward to the other stakeholders, we've got employers. Employers can choose a champion within the leadership team who is responsible for the implementation of peer services, who will recognize and support those disruptive innovations that come from those in the peer specialist role, and just really support that. Encourage or ensure all members of the organization understand the role of a change agent and support the concept of peer specialist as disruptive innovators, and makes peer support a choice for all people who are receiving services. So these are all things that were suggested by people in that workshop. Certainly there's many, many more things that we can, tap into, and we would love, as you go through this document and start working with it on your own, if you come up with other things, we'd love to hear it. We may be able to collect other recommendations and somehow make them available over time. So another stakeholder group is the policymakers and funders. Recognize contributions made by the peer specialists who serve on advisory boards or work towards changing the system for their valued role as change agents, and include in requests for proposals for human service grants that involve services to people who have mental health, trauma, or substance use conditions, a minimum required number of staff and advisory positions to be people with lived experience, preferably peer specialists, active peer specialists, and train non-peer staff about the advocacy and system change role of the peer specialist on a multidisciplinary team. So this is where we're going to sort of set the stage for all of you to thinking about the valued role of a peer specialist as a disruptive innovator, and what kinds of things that you can do in whatever stakeholder role you have within your organization. Think about one action you can take to advocate for change to ensure that that change agent or disruptive innovator role is supported. And what I'd like to do is give you just a minute or two in the chat to complete this sentence. One thing I can do for this priority is. So I'll stop for a few moments and allow you to think from your stakeholder role, one thing that you can do to advocate for peer specialists to be valued as disruptive innovators. Nice. Post articles on social media. Better job opportunities. See the disruptive innovation role in advisory boards. And I'm going to lose this very fast. Chat's starting to move quickly.
I'm sorry.
Can support my peer staff in educating non-peer staff, as well as support their self-care.
Mm-hmm.
One thing I can do, hi Laura, is continue to empower new peers in the workforce to be active in their advocacy, right? That's really important. One of the things that I know is always a risk when you have a growing movement, a growing workforce, is that some of the early history and that advocacy piece could get lost if we don't keep our eye on that. attend county legislators meetings regularly and build a relationship with them to understand our role as a peer-run agency.
That's huge. Thank you, Karen.
Yeah, so many people at those levels, part of the issue is just they don't actually know about peer services. So bringing that awareness is actually a huge thing we can do. Bring these recommendations to my consulting and training participants. Absolutely. And thank you.
Yeah.
I love disruptive innovator and change agents. I've begun discussing with my supervisor areas where we can make changes in-house, and I sit on the DEIA committee.
Wonderful.
So that's a great thing to do, right? Start at that level just with your supervisor. There's a lot you can do just starting at the ground level. Also offering suggestions directly to the peer certification board.
And I just wanted to back up to what Karen mentioned earlier about going to, the policy meetings, with the county legislators or anybody who's, making policy. Advocating with the policymakers, and even if it's not advocating it, like Jeremy just said, sometimes just educating, here's this role that, is really able to help make system change happen, and how can we support that and make it a we rather than a you as much as possible as we do our advocacy work or educational work.
Also, I think helping people understand, I mean, the term disruptive innovators is appealing and it's also scary. And so I think having an attitude toward recognizing that change is not so easy often for any of us. And on the one hand, on the other hand, it's really necessary and important, especially when we have a role that we've shown, there's evidence showing that peer support really can make a big difference in helping people get their lives back. So it's somehow understanding both sides of that and empathizing with the people that are uncomfortable about change. But that's challenging when you're supposed to be the change agent, aren't you uncomfortable too? Yes.
It is. And I always say the peer specialists who really do that, it takes a lot of bravery because
Yeah.
you are putting yourself out there in a way to be sometimes a very lone voice, right? A very different voice than what other people are hearing. But I do think one of the best things to do when you're doing that kind of activity is to actually set that stage with, the people you're working with. So if you're part of a multidisciplinary team and you actually start the conversation by explaining in the peer role, being that disruptive innovator is part of what you do. You're not there just to make everyone feel bad, but sometimes these conversations are uncomfortable, but we can all grow from them. Sometimes if you set the stage that way, it actually helps people to feel safer about it because it's now a little bit more predictable that it's going to be uncomfortable. It doesn't just feel like someone who's in there blowing things up.
And it's not the end of the world, that there's a goal in mind, for better working environment and outcomes for everybody.
Right.
It is easy to get sort of stuck, in the fear place.
Right. It becomes productive, collaborative conflict as opposed to just butting heads.
Yeah.
We also, Taylor said, advocate to your local mental health authority. They are the ones who pay the bills. I agree with that. Karen said, education is key for all of us. Yes, it definitely is. Shannon, yes, I can also advocate for myself as a self-identified peer supervising other peers to have trauma-informed manager training. And one of our items, as you might have seen on the list, is very much about being trauma-informed, which, when that got really popular in services, which it should because it's important, but it was always about trauma-informed services. And one of the things that we realized talking to people is people also need to have trauma-informed workplaces where their own trauma is safeguarded within the organization. And so when they come to work, they're not feeling re-traumatized or that they have ways to to deal with traumatizing moments that they may face.
And one realization I had very recently was that having somebody advocate to, somebody else can be traumatizing to the person, like a supervisor who doesn't realize that what they're doing, and somebody advocating in a forceful way can be very traumatizing. So there's lots of ways trauma can happen. And it's really looking at how do we not do that to each other, and how do we work through when things happen that are upsetting to people.
Um, Another comment, one thing I can do is always be open to learning and unlearning.
Mm,
Unlearning harmful strategies that were so prevalent when I was coming up in my own sobriety.
mm.
Learning how to support my coworkers and organization to keep us moving forward with empathy and understanding and meeting people where they are at. Yes, absolutely. I can promise you that early in my career, there's things that I said or did that later on I was like, oh, maybe that wasn't the right way to do things. So sometimes we do have to unlearn some old patterns.
That could also be falling into the bucket of the allied workers, the allied professions.
Hmm.
Yeah.
Start local is a good idea, says Deborah. Richard says continue advocacy on importance of peer workforce and peer programs at state level with Mental Health Services Oversight Accountability Commission. It's a mouthful. In the act of the Mental Health Services Act allows to fund peer programs, but has underutilized this significantly to serve our community and needs. So definitely and depending on what state you're in, right, there may be different governing bodies, different organizations, different groups that you can utilize for that purpose. Betsy says, I am a PSP and building a CAB. I'm not sure what CAB is. Does anyone know?
I don't.
Okay. Uh, of law enforcement,
Community
PWL.
Advisory Board, maybe. Yeah, maybe a
Yeah, I'm not
community
sure
advisory board.
PWLLE. Oh no, I'm going with the acronyms today. PSPs is peer support specialists or providers, I think, peer support providers and behavioral health partners, stakeholders. Don't love the term stakeholder because it is rooted in colonialism.
Mm.
To figure out how we can revise some of the policies related to peer support, such as integrating peer support into the jails. I work for a local public health agency as a community engagement specialist, but trained and certified in peer support. Thank you, Betsy.
Yeah.
Katie said, wondering how an org would best support a change maker. I imagine harm can come to that person if not supported by those with power. Absolutely. And that's one of the biggest challenges we can face, right? If we're working in an organization that shoots us down instead of supporting us when we are trying to make change or when we are being that disruptive innovator, I think the best thing to do if you're in that kind of organization, well, one thing is to find a different organization, I suppose. But if that's not always a realistic suggestion, right? Jobs don't always just fall off of trees to people. So I think in those situations, a lot of times it's then about identifying who can be your allies, right? Who are the people who are going to be supportive? If you can't get it from all of the leadership at an organization, is it possible that you can find one person in leadership who maybe will be a little bit more on board with things?
I think that's where go ahead, Jessica.
Well, also, I'm just thinking about the importance of having one's own support network, both personally, but also professionally. I know in my own career, nobody told me about this at the time, but I just sort of instinctively got to know certain people who I would then consult, like when I didn't know what to do, I'd get in touch with them and say, what should I do? What do you think? And of course, you always have to consider the source and figure out, what I want to do. But having a network of people who are knowledgeable about one's particular situation and experience is just very helpful. And not infrequently, it may be outside the organization, maybe inside, maybe not, but certainly outside can be very helpful.
Yeah, not for nothing. That's how I found these lovely people. Lewis says to tell my story to as many people that I can, especially in local and state government. This is my passion. Don said also helpful to mention what you see within yourself to make improvement and foster change. That's great. Definitely, like I love it when people recognize their own internal strength and tools, and sometimes we forget how powerful that can really be. Shannon says exactly. I'm not sure which point she's exactlying, but Richard said California is totally focused on community health workers than peer specialists with significant more funding. Yeah, that's a dynamic. I think we were talking about this the other day. There's kind of, I hate it when there's a situation where it feels like different groups of, professional roles are kind of like in conflict with each other when they don't necessarily have to be. But unfortunately, sometimes the dollars are a little bit too limited and we get into some of these tricky situations.
And New York City has lumped together community health workers and peer specialists for quite a while now. And so they do a lot of data gathering, but it's for both workforces.
Right.
Yeah,
And then, of course, they're not actually the same thing.
right.
Sean said, continue to speak up about the values and valuing of peers so that all peers, including those already working in the workforce and non-peer identified roles, are appreciated for the insights that come from lived experience, appreciated and valued like a biculturality.
That's cool.
That's a great idea. Here's some of the things I was confused about earlier. Community advisory board, peer support professional, person with living and lived experience. Thank you, Betsy. And Karen said, we are so excited. We have had a peer program in the jail for the past 10 years. Others said it could not be done, and it has been very successful. Never give up. Try, try, try. And of course, we know this, right? We know this as peers and peer specialists, that when we have the opportunities, we do pretty well. We do a pretty great job at sometimes making changes where other kinds of services have not. And so I think it's always important to point that out. We're not there because we're cheap labor. We're there, and we shouldn't be cheap labor. We're there because we are effective and able to actually bring about changes in services. A couple more. We got, I think it's Michael. Advocate for trauma-informed, trauma-engaged, and trauma-informed responsive culture within the organization made of peers. Trauma-informed care services does not mean a trauma-informed organizational culture. Healing-centered engagement is not just for participants, but also the culture in which we treat staff. From there, we can move towards a healing-centered, engaged culture. That's great. I love that. One of the things I've been saying to a lot of people recently, especially when my organization does some consulting with provider agencies that employ peers to kind of help them to build and grow and improve their peer services. And one of the things I always say is that if you have an organizational culture that's friendly to peers and write policies that are peer friendly, what you're actually doing is you're writing organizational policies that are worker friendly. And that's going to help you with your entire workforce, not just your peers.
Yep.
Great. Thank you, Jeremy. And I think we did just go through that debrief with you just now. So I'm going to pass it on.
That's what I thought I was doing.
Yeah, you were.
I guess we just didn't have the slide up.
No, it's okay. So I think we pass it on to Jessica now.
Well, we're just going to summarize what we did now that we did it, right? Or what you now should be able to do. Recall some of the top 10 priorities identified by the peer workforce, but you can get the document and then you can have them. Recognize at least one recommendation you can personally get involved with. So it's real, as we've said before, it's important to us that that this is a working document for you, for people who are reading it and absorbing it. Name strategies for advocacy with different stakeholders. So yes, again, and we've had some of that conversation this afternoon. You know, one's proceeding with the supervisors different from a policymaker or a fellow peer, et cetera. And it's important to recognize where people are coming from. Use and share the action agenda with others for future advocacy work. And not, I guess on this slide, we don't have it, but the next one, we have the QR code and the URL. So if you didn't do it before, you can do it now, and you can put the document up without leaving the Zoom, and then come back to it after we're finished. So do people want to raise any questions or other comments?
Yeah, I
As
see
we're-
Shannon put something in just a minute ago that lived experience is just as valuable as a degree and probably costs more. Yeah, that's a great point. Helping those non-peer staff to see that involves peers with a good ethics and have good self-care. I think I didn't read that quite right. Helping those non-peer staff to see that involves peers with good ethics and good self-care. Right. Good. Thank you.
I will also point out that Hannah did put the link in the chat as well. So
Yep, I see Karen. I see Betsy said, Karen, we need policy changes here because criminal backgrounds are a barrier. Yeah, in a lot of places. And we know if a peer support professional or practitioner has a criminal background, that means they are more qualified to work in a carceral setting. Absolutely. Did you run into this barrier and have done policy changes? We are implementing community advisory board to try to shift the culture toward a recovery-oriented system of care.
You have had one question come through the Q&A as well. Katie asked, are there any states who are successfully focusing on these priorities right now?
Oh, that's a big question.
who's taking a crack at it?
That's a good question. We actually have been in touch with the National Association of State Mental Hygiene Directors,
Mental health program directors. Yeah.
program director. Yes, NASHBIT. We have
Right.
recently been in touch with them, and that's a great thing for us to ask. Is there any way to do kind of a state-oriented project using these priorities? That's a really great way to frame it, and I don't think we had thought of that even. So that's good.
I mean, we don't have the answer to your question.
Right, right.
One thing I would maybe suggest is if you're, trying to figure out what's happening in your state, you might actually bring the document to some of the people who might have some control over that in your state and ask them, are you addressing these priorities? Can you tell me how?
Oh, just think we could develop a rating scale. For each one of the priorities.
And remember, the action recommendations that we put into this document are just a very tiny, this was one workshop where we had a wealth of information that came from one group, but there's many more recommendations that may come from talking to the different stakeholders. Now I'm conscious of the term stakeholder. I had not thought of that as being a term that anyway, with different groups of people that may want to be involved in becoming part of the solution as opposed to part of the problem.
Someone on the chat also sent a question, Betsy. She was asking the group, but I wanted to call attention to it. She said, does anyone have a good job description for a PSP working in the court system / jail? So if anyone does, feel free to send that in the chat for Betsy.
Rita, do you have a response? Because I have an idea, but go ahead.
I was thinking that I might, in a follow-ups, get you connected with Helen Skipper. She's with the New York City Justice Peer Initiative, and she's been doing a lot of work in this area. She might have some good ideas. She's getting national recognition.
Yeah.
I'll connect you guys after the fact then. Thank you.
Yeah, I also I also, in my last role, one of the other programs that my organization was running was very much doing that. It was peers who were going to court and assisting people who it was, I'm blanking on what the acronym is right now, but basically alternatives to incarceration type programs to try to help them to get connected to community supports instead of being sent into jail or prison.
The other idea I had is that Susan Rogers maintains this key update from the National Consumer Self-Help Clearinghouse every month, and you can get on her mailing list, but she's particularly interested in this whole issue, and she puts out every month a whole bunch of resources. She might be someone who would have some good ideas about getting a job description, you know, like where she has a sense that people are also doing this work.
Yeah, I wanted to back up to Dawn had mentioned a support group for peers to come together and be empowered beyond their fears and conflicts and barriers could also be beneficial and supportive in an effort to promote this type of change. And I think, Jessica, you spoke to that, you know, by having outside folks that you can turn to debrief with things that are happening inside. Yeah.
Does the Academy of Peer Services have a support group of working peer specialists?
Yeah, we do every Tuesday night. So in the follow-up, Hannah, remind me, I can give a link to that as well.
Are people able to join that even if they're not New York based?
Yep, it's open to anybody. We have people coming in from all over the world, actually.
Okay, great.
So, yeah.
Yeah, because I think that's knowing, even just knowing that there's such a group, but then being able to participate in it is very, very important. It does bring back memories. I mean, I didn't work as a peer specialist, but I was in advocacy and planning roles, and I was like, I didn't know what I was doing at first, and then, you know, and as I said, I'd sort of get to know people that were in similar roles, and I'd call them up and say, what should I do? You know, of course, it's important that they were trustworthy, you know, and competent and so forth. But anyway, it meant a huge amount, and it taught me a career-long lesson. We all need people like that in our work.
Yeah, I wanted to loop back around just before we wrap up because Karen had mentioned dealing with the criminal background check, that they have not in her organization had any trouble going through a background check. And yes, each peer working in the jail has been incarcerated. If they hadn't, they could not provide true peer support services. Wonderful. Wonderful way to frame it. We've not had any problems with that. Our working relationship with the jail is key to trust. They know our policies and procedures are clear and complete. Our peers are titles in jail transition coordinators, and we have presented our program in Washington, D.C. So not sure if you can help Hannah to make sure that people have a chance to connect with each other following this. I'm not sure exactly how that might work, but I'm going to put that back to you. Maybe Karen, if you wanted to put your email in the chat and then we send the chat out just to the people that were here. Does that make sense?
If there are folks who specifically would like their contact information shared with everyone, I can send that out in the follow-up. I just can't share the chat with everyone who attended, but I can send specific contact information if people request it, if that makes sense.
Sounds good.
And we
Somebody raised a hand. Marguerite Johnson. That's where is?
Sure, let me figure out how to give her speaking permission real quick, if that's okay with you guys.
Sure.
Yes.
Margaret. Okay, Margarita, I just gave you permission to speak, so you can ask your question out loud.
Yes, hi everyone. My name is Margarita Johnson Tolson, and I'm happy to be here. I didn't even realize that Rita would be on this thing, but she talked about the Tuesday night group that they do have, and I would love for everyone to come one Tuesday night. I've been going for a while, but because of transportation, I pop in, but that's a place for me to go and get encouragement, to feel happy, you know, when I'm sad, because everybody has something to say. And, you know, we all are peers together. I am a social worker, but peer work is the world for me because I have lived experience. And that means a lot for me to know that I have somebody like me that's really involved in this kind of work. And I want to thank each and every one of you for being on this call, that I'm able to be on with you, and we combine together as one. In regards to the prison information, I have a lot. I'm a woman that was impacted by the criminal justice system. So I have a lot of information in that, on a certificate of good conduct with that, you know, reinstate your rights to vote. And I have a lot of information in that. I'm also have access to the prison where I joined the AVP program. That's Alternative to Violence program. And we do teach, you know, each other how to avoid conflict. And if we do have conflict, how to handle it. We all have a toolkit that we carry with us. So I would love for my email to be shared with everyone, and we could discuss that. I would love for everyone to get involved with the Tuesday night group. I just lost my mother, and I was able to go to the Tuesday night group, and I felt renewed. Rita, and you know, they welcome you, everyone that's on that. There's a place for everyone right there. It's never too crowded, it's never too much, because everyone listen and everyone share their experience in regards to what you're talking about. So again, everyone, Jeremy and Jessica, and there's another person, Rita. You know I love you madly. Thank you for everything. Thank you for restoring my spirit when it's down, because it do get down sometimes. And I thank you all to be here. I thank God for sparing each and every one of you, including myself. Thank you for sharing your space with me. I am very grateful because I am going through a lot. I don't want to stop doing peer work. Peer work is what keep me alive. It's what keep, there's something to gain each and every time. Like this group, I feel the spirit. I feel I was like, my anxiety was off the hook when I couldn't get on. So again, thank you, thank you, thank you, thank you. All the blessings to you. And
Thank you,
Thank you.
Margarita. It was good to hear you.
Thank you.